There's a range for what a normal menstrual cycle can look like. On average, it should be somewhere between 21 to 35 days. It doesn't have to be 21 days every time or 28 days every time. There can be some variability. Some patients feel like, oh, my period's sometimes 28 days, sometimes 32 days, and so it's irregular. And that's not the case. There can be a little bit of variability. And also your period's not going to come on the same date of the month because every month has a different number of days. So if you have a way to track, again, between 21 to 35 days, we would say it's regular. Periods that come more frequently. So some patients might say, I have multiple periods in a month, which, if it's a longer month, maybe that's true, but if it's every 2 weeks that you're having bleeding, that's something that you should talk to a provider about. They're probably not menstrual cycles. You're probably having vaginal bleeds or uterine bleeds that are not related to you ovulating, and it's only bleeding relating to ovulation that would be a period. You can also have periods that don't come frequently enough. So if you're not getting a period, you're skipping months, maybe you never get a period, obviously that would be irregular. Not just the timing of the period, but the flow. If you're someone who has had kind of pretty average to heavier periods, and then all of a sudden your periods are very light, that big change happening all of a sudden, that should be something that you talk to your provider about, especially if you've had a procedure where the inside of the uterine cavity has been operated on or procedure has been done on it. Similarly, if you're someone who's had very light periods and all of a sudden you're having heavier bleeding, that's something you should talk to your provider about. If you're not having a regular menstrual cycle, you should speak with either your OB/GYN or your reproductive endocrinology specialist so we can start to do a workup. As we mentioned, there's a big array of things that could be going on, but if you're not having regular monthly cycles, then you're not going to be able to conceive at the same efficiency as someone else who's having kind of normal bleeds.